Hello everyone, my name is Christine VanLenten. This is my introductory video for this course. A little bit about me. I'm from northern New Jersey, born and raised here, and I completed my undergraduate degree with the University of Scranton. I graduated in 2012, and at that time I was fortunate enough to get a nurse residency position and extended very thorough orientation in my hospital near my hometown, so I moved back to New Jersey at that time. I currently live about 45 minutes south of there in a small city called Jersey City. It is right across the river from Manhattan, the Hudson River, so it's a really great area. It's a short commute to my hospital, and in my hospital I work in the ICU. I have been there for the past 4 years since that nurse residency position. It is a small community hospital, so we have 14 beds, and we take care of medical, surgical, as well as neuro and neurosurgical critical care patients. Being a small community hospital, I am very fortunate that it's right outside of Manhattan. I know oftentimes small community hospitals don't necessarily have a lot of great technology because depending on how remote they are, but fortunately, like I said, being so close to the city and a lot of other opportunities, we do have a lot of really great advanced technology. We take care of some very interesting cases, so this has been a really great learning opportunity for me. And being in critical care has obviously sparked my interest in critical care nursing as well as nursing education. Obviously, two of my passions. I would say my passion for nursing education actually started in my undergraduate years. I went to the University of Scranton, like I said, which is very similar in my mind to Gonzaga. It is 4,000 undergrad students. It's also Jesuit, and the program was also kind of similar to Gonzaga. Great program, great professors, smaller, intimate class sizes, really optimized my learning, and it really piqued my interest in nursing education, seeing my professors be just the wonderful nurses and professors that they were. I kind of looked up to them and realized that I would want to do that one day. So that was about 6 years ago. Fast forward, I started this program about 1.5 years ago, and I'll be done this semester. I do see myself in the academic setting more than the clinical setting, based on my influence from, like I said, my undergraduate professors, and I had taken the practicum in academia last semester and really enjoyed that. I loved working with nursing students, but this semester I am taking my practicum in the clinical setting, and I'm very eager to see how I like that, how it compares to the academic setting. So I'm not closing any doors. I just kind of have always seen myself in the academic setting. But like I said, I'm really open to anything, and we'll see how this practicum goes. I do not see myself necessarily transitioning to a nurse educator role immediately after graduation. I still really love my bedside practice. I love taking care of patients. I love critical care. And like I said, I've been a nurse for 4 years now, so I still feel like there's obviously a lot more to learn. I do think it's important to have my own bedside practice for a while before I transition to a full-time educator role, because I obviously don't feel like I've gotten as much experience as probably many of you do. So I do value staying at the bedside for a little bit longer. Eventually, I think my first transition into the nurse educator role may be in a smaller role. I would really love to have my own bedside practice part-time, and then maybe get the opportunity to work as a clinical instructor part-time as well at a local university. That way I can work as an educator but also still have my own practice, so I can stay up to date and current on all nursing practices and everything. So I'm not ruling anything out. We'll see where the future takes me, but that's kind of how I see my trajectory in my nurse educator career. Like I said, this is my last semester. I will graduate this August, as I think some of you may as well. So I see the light at the end of the tunnel. I'm very excited to graduate and to use this in my bedside practice and also in the future as well. I'm looking forward to working with many of you this semester, and thank you very much for watching my video.